Start. So first we're going to greet and identify the client. Good morning, sir. My name is Princess Panlican, your student nurse from Our Lady of Fatima University. Please state your name and your birthday.
NJ Palikan, December 20, 2010.
Check ko lang po yung wristband. So after that, we're going to explain the procedure. So today, sir, I will be assessing your peripheral vascular system. And next is we're going to position the client appropriately and comfortably. So sir, comfortable naman po ba kayo sa position nyo?
Yes po.
Which language do you prefer po? English or Tagalog?
Both po.
Okay. Next is we're going to provide for client's privacy by closing the blinds or closing the door. Okay. And then next is we're going to wash your hands. I will be sanitizing using an alcohol. And then after this, we're going to inquire for the client's history of heart diseases, varicosities, arterial disease, and hypertension, and his lifestyle habits. So, sir, meron po ba kayong history na sakit sa puso, sakit sa dugo, high blood?
Wala man po.
Okay, so, kumusta naman po yung sa lifestyle nyo? Like, active naman po ba kayo? Nag-exercise lagi?
Yes po.
Umiinom?
Hindi po.
Naninigarilyo?
Hindi po.
Okay, so after that, we're going to assess for the peripheral views, and here we will check the limbs of both arms and legs for the presence of superficial veins when dependent and elevated. So, sir, check hawak po ako, ha? Okay. Sa kabila po. Okay, sa paa. So, while doing this, you can also assess for peripheral perfusion. You will assess the skin for color, texture, edema, and skin changes. So, next is we're going to palpate for peripheral pulsations. We will check for the pulsation on both sides individually and systematically. This is to note the symmetry of pulse, volume, and pulsation. So, sir, mag-check lang po ako ng mga pulse niyo po. Okay po. Okay, so... Okay, dito naman po. Naman po, paki-extend po yung paa. Okay, sa may paa naman po. Sa may dito. Okay, so after that, we're going to assess for the peripheral veins. In here, we'll be checking the peripheral leg for the presence of phlebitis, and then we're going to note for tenderness and pain upon forceful dorsiflexion in the calf muscle, and then check for Human sign and if it is warm to touch. So, sir, hahawak po ako dito sa may dito niyo po, and sabihan niyo po ako kung may nararamdaman kayong masakit. May masakit po ba?
Wala man po.
Okay. Then after that, we're going to assess for the peripheral perfusion using the Berger's test. So, Berger's test, also known as arterial adequacy test. So, here we're going to ask the client to raise his arm or one arm or leg and for about 30 centimeters. And then, we will ask the client to move his feet or hand for up and down for about a minute. And then, ask him to sit up and dangle his leg or arm, and then check for blood return. Originally, it takes about 10 seconds, and for the veins to fill again, it takes about 15 seconds. So, sir, pwede po kayong humika. And then, itataas lang po natin yung paa nyo. Okay? So, sige po, iga lang po kayo. Tapos, sir, pwede pong pataas baba po to na ganyan. Parang ganyan-ganyanin. Yan. Tapos po, uupo po tayo, okay? 1, 2, 3, upo po. So, i-check po natin yung leg. Okay. Okay naman po. And then next is we're going to assess for the capillary refill. Here is we're going to squeeze the fingernails and toenails of the patient until it turns blanching, and then we will assess for the blood return. So, sir, I-squeeze ko lang po, or pipindutin ko po yung mga daliri niya para check ko lang po yung pagbalik ng blood flow. Ayan. Normal refill should takes less than 2 seconds, 2 to 3 seconds. Okay, isa pa naman po. Kabila po. Okay. So after that, we're going to position the client appropriately and comfortably again after the assessment. Sir, ano po yung gusto niyong position? Ganyan po o hihiga po kayo?
Kung ano po yung mas okay.
Okay, sige po, higa na po kayo ulit. And then after that, we're going to inform the client about the necessary findings. So sir, okay naman po yung yung mga findings, wala naman pong mga not normal. And then after that, we're going to wash your hands, document the findings, and report the client any deviation from normal.